Finding the right counsellor is, in essence, the difference between mental health recovery and not. I think sometimes there is a understandable frustration for people when they go and see someone and they're like, this isn't working for me. But I think sometimes we do have to approach it like we're looking for the right car. And I use that analogy because cars are expensive.
Hello, I'm Dr Jodi Richardson, and you're listening to, well, Hello Anxiety, a podcast where we end the struggle with anxiety and build our toolkit of practical skills to thrive. Hello, lovely listeners. Thank you for joining me for another episode of the podcast. I'm super excited to introduce you to today's guest so we can both learn more about mental health first aid. There's so much to know around mental health first aid, and we need to start thinking about mental health first aid in the same way that we do physical health first aid. And Jacqui Cousins is the person that will be able to really support us with our learning today. Jacqui is a credentialed mental health nurse, and she's founder of Nursing the Mind. I love the name of your business, Jacqui. It's perfect. Over the last 25 years, Jacqui has worked in hospitals, in education, in private practice, and in community health. In particular, Jacqui was fortunate to work in a unique community health program supporting young people and their families over the long term, which is always very special when you get to work with families over a period of time because you can see the outcomes that you're working hard towards. With a team of dedicated clinicians, Jacqui provided care coordination and counselling under her self-titled role of mental health concierge. I love that too. The role was key to understanding how difficult it is for people to navigate the health service and how communities must work together to improve access to all health services. Jacqui's love of learning includes a Master of Public Health, which informs her holistic and person-centred approach and belief that resourcing people is crucial to them living their best life. And Jacqui, thank you for sharing your expertise with us today to really help build our knowledge and our resources so that we can all support the people around us as well. It's a really lovely pleasure to have you.
Thanks, it's lovely to be here.
Thank you so much. Now, it's you've got a lot of experience under your belt, and we're really lucky to be learning more about mental health first aid. And this is something that I'm familiar with in my line of work, of course, but a lot of people may not have heard of mental health first aid. Could you start by sharing with us, what is it exactly?
So mental health first aid was developed over 20 years ago by Betty Kitchener, who is an educator and mental health consumer. And she did that in partnership with her husband, based out of her own lived experience of accessing mental health services. And the aim was creating the program to extend the concept of first aid training to include mental health. So many people actually understand what physical first aid is. So the idea of mental health first aid is about empowering people to know how to better support someone to access the services they need. So many people who are in mental health distress or really, you can tell they're really struggling. The program is really geared towards the community to be able to sort of step into supporting that person and doing so with confidence. What I love about the Mental Health First Aid Australia program, there are other programs out there, but I love Mental Health First Aid Australia's program because they developed the training with the lived experience in mind. So throughout the training, they include artwork from people with a lived experience that gives people an understanding of what it's like to have anxiety, what it's like to have depression, psychosis, substance abuse problems. They're the main four that are actually covered in adult mental health first aid training, but they also have, they cover mental health first aid training for youth, for teenagers, supporting one another, for older persons, for Aboriginal and Indigenous communities. So, over the last 20 years, Mental Health First Aid Australia has developed a really comprehensive program that, is all about supporting the community, and it's evidence-based, and that's in healthcare. as we both know, that's so important because we want to make sure that the resources we're giving people are based in evidence.
Yes, and what I understand about your work is that you are a mental health first aid trainer. That's a really big part of the role that you play. And so you are able to, anybody who's listening, if you listen to this episode and mental health first aid training is something that you'd like to undertake, I'll share all of Jacqui's contact details so that you can connect with Jacqui at the end of, at your leisure. I was going to say at the end of the episode, at your leisure, you can connect with Jacqui and learn more about when and where you can undertake that training. And I know a lot of listeners will be parents of young people who are struggling with their mental health, or perhaps partners of somebody who's living with a mental health condition, some teachers as well, and also people who might struggle with their own anxiety but might not see mental health first aid training as something that's necessary for them. So who would benefit from undertaking mental health first aid training? In my view, it seems like everybody would benefit from it. What's your view?
Definitely. So I've actually been training up a wonderful team of professional organisers from the art of decluttering for the last couple of years, and it's been a real pleasure because sometimes people, there are industries around mental health and healthcare that actually work a lot with people, work with people's social health needs, but they don't necessarily see them as mental health clinicians. So the idea of mental health first aid is supporting community groups and community members who are working with people to support, whatever it might be, even massage therapists, hairdressers, those kinds of things. So that if and when somebody does share difficulties, that they sort of are equipped to know how to support them. So for this lovely group of professional organisers, they now, when they're doing, helping someone address their home environment, which is such an important part of mental health, is improving your social environment, they actually now are equipped when they go into a session. So if a client does get distressed, they feel resourced to be able to deal with that. And most importantly, it's accessing people to professional support and giving people hope for recovery. And I think that, that's in essence what mental health first aid is about. Is I think sometimes in many cultures, but particularly Australian culture, we can be very generous with advice. But sometimes it's telling people what to do rather than supporting people in finding the services that they need. And as Brene Brown says, who we both love, it can be power over, not power to. And so mental health first aid is really about empowering somebody else to support them on that journey, and also handing them on. So not being left with the responsibility of, and so some of the, within the training, we talk about that. So how do you sort of move someone on, encourage someone to access GP support or specialist mental health support? Because and as I said, when it comes to a bit like grief, most of us want to support someone who's in a stage of deep grief, but we often don't know what to say. So we say nothing. And that silence for the person who's in distress can be really overwhelming, because it often communicates that they don't care, which we do, but we just don't know what to say. So mental health first aid training is really about equipping people in what to say and saying it in a way that's supportive and encouraging, and then helping people on their mental health recovery journey.
It's very important. It's so important. And I love that analogy that you've shared. It's the same as if you've never had physical first aid training and you are the first on the scene of a car accident and somebody has broken a limb or is bleeding, and you just shell-shocked, overwhelmed, and like you say, you don't want to do any harm. You don't want to do any harm, but you don't know how to do any good. And so sometimes it's obvious that people can do nothing because they don't want to say and do the wrong thing to make things worse or to upset the person any more than they're already upset. And so it's really a lot about confidence, isn't it?
Absolutely.
What sort of insights are your students able to take away from the artwork that's shared by those who have lived experience with mental illness?
I think what it does is it actually takes away judgment, or it really torpedoes judgment, because it helps people really see the person in their full self and holistic self. Particularly the artwork for anxiety, there's a comical element to it, which is really interesting. And so I think for me, I actually did some training, some community training, to see if it was a good fit for me, because I was looking at maybe doing it, becoming a trainer. And I loved it so much, and it was actually the artwork that sort of really said to me, this is a good fit for me and my values. Because having worked in community health for a long time, the lived experience is really the area of healthcare that we're slowly shifting into. But to provide excellent healthcare, we have to listen to people and their experiences. Because whilst everyone's experience is unique and different, there are fundamental principles that serve all people. And we need both the health worker and the person with a lived experience, so we can actually tailor programs and health services to meet those needs. And I was just fortunate to work in a health program that really thought to do that. We fortunately had a lot of autonomy as a program. We didn't have a lot of eligibility criteria, so it gave us a lot of flexibility to tailor our program to the people's needs. And then very much, we over time adjusted how we did things based on their feedback. No health service is perfect, for sure, but I think when there's a attitude or a value of actually wanting to include the consumer's voice, which consumer is the word that's used in healthcare at the moment,
yes,
it's about giving people a voice. So in 2015, the Mental Health Act was changed for that purpose, to give people more power over their healthcare. It's a slow process to really fulfilling that. And I guess as a nurse who studied public health, that's a real a commitment of mine to be somebody in the community that's reminding us that we always have to have the lived experience. And I think that's why mental health first aid for the broader community, as they train themselves up in caring for those around them, is it really does bring that to their mindset of, I really need to listen to what the person's telling me, and not just come in with a 3-point, you do this, do this, do this, because that's not necessarily going to work for everyone.
I completely understand what you're saying and appreciate that approach. It's not a one size fits all. And I think bringing in that lived experience to help students really get more insights into what it's like for people like me who live with an anxiety disorder, or somebody who's experiencing depression or substance abuse. For people who haven't had that experience themselves, I think it's a really beautiful way to really increase their understanding, and it's also a way of helping reduce stigma around it, I imagine, as well.
Yeah, definitely. Stigma is a challenge. It's even a challenge, I think, within the health service. There are certain mental health conditions that still have stigma attached to them. And so, for example, borderline personality disorder, which really is, for people that have that condition, they often struggle with overwhelming emotions, interpersonal challenges. And many people with a BPD diagnosis really struggle with a stigma attached to that. But what's really valuable is, coming up next month, which is Mental Health Month, is BPD Awareness Week. And so what I'm really hoping to see, that as the BPD community share their experiences, it helps normalise and understand this mental health condition that kind of has been put in the too hard basket. But I've been fortunate to work with a lot of people with BPD, and they have taught me so much, And now I feel like I'm better equipped to better support them. So obviously everyone with BPD has different experiences, but at the same time, having talked to a lot of people from the community, it's helped really improve and inform my practice. so that I don't get caught into that stigma. But I think, you know, in terms of stigma in the community, we are slowly getting there. I think anxiety and depression is definitely more accepted, but I still think we've got a way to go for people to feel comfortable to say, yeah, I saw my doctor because I'm struggling with depression, like we would a sore knee or a sore back. You know, I think there's still a long way to go for us to normalise. I mean, seeing the doctor, I read an article last week that says seeing a doctor for mental health problems is now the number one reason why people see a GP. So we really have to push past and push through this to sort of be able to get to a point where we can talk about it as we would having a sore knee or a sore back. And the Mental Health First Aid really does achieve that, because I was fortunate to actually train 3 of my sisters. So I have 3 older sisters, and obviously because I know them really well, watching them train and seeing lights go off in their brain and them coming away with a greater understanding. It was very intimidating training my 3 older sisters, but it was a really lovely experience, because I really saw the value of the program in its entirety, because I saw 3 people I know very well engage with it. Clearly, I love it.
Yes, I love that you love it, and it astonishes me that in 2022 that young people in school don't learn the foundations of mental health in the same way that they're, you know, I'm not familiar with the curriculum in our schools with regards to what they're learning in physical health in primary school. I was once a secondary school educator, but our children do learn about the role and the function of basic parts of their anatomy, and it's really my hope that mental health and an understanding of the brain and an understanding of emotions, and that really becomes a very integral part of not just a unit in school, but just an integral part of education as a whole, because I think that understanding and that recognition that we feel all feelings, that all emotions are okay, that we do have this response that is called anxiety. It's protective, it's important, it can make you feel pretty yuck, but that understanding, it takes away a lot of the fear, doesn't it, as well, when then there's just more insight and education around mental health as a whole.
That's it. I have worked in schools, so it's an interesting reflection, because I think from my experience, and you know, lots of schools are training young people in mental health first aid, which is awesome. There's absolutely mental health in the curriculum, so certainly in Victoria, but you know, in other parts of Australia too. I think the challenge is that there's a bit of a chasm between our understanding of mental health and then our ability to access treatment when we need it. And I was thinking about this morning, with education, we talk about the straight or the winding path of education. So some young people do year 12, go into the course and off they go. Other people, it's a bit more of a winding path. So, you know, they might go to TAFE and then go to uni. And whereas I was thinking about it, the health service is a bit more like a maze in that you get in and then you get it to a dead end, and then you've got to. And so one of the things I'm really passionate about is helping people navigate the health system. You know, the health system is an incredibly large system. It's a wonderful system that's under significant stress at the moment. The workers are exhausted, and it's sort of a perfect storm for healthcare to not be operating at its best. And I think that we all need to acknowledge that. But then it's about what can each of us do as a broader community, hence my sort of passion about it's a community. Public health is all about the community, different, you know, the health sector, the business sector, the education sector, all working together towards a common good. And at the moment, I think some of the work that needs to be done is how to support people to know which part of the health system they should be accessing. GPs, again, are one of the first people that see in terms of navigating the health system, but they're also in massive high demand at the moment, and their capacity to deal with complexity of care is is low, or it's a real challenge at the moment, and perhaps there are, as there often are, there's gaps in the health system. And for me, I believe that one of the gaps that needs to be filled is in that general practice space. You know, GPs, I've worked with some wonderful GPs, and I think that they, like teachers, they don't actually get the respect that they deserve, because they're all things to all men. But at the same time, I don't think that general practices are necessarily as well resourced as they could be. And so, for example, you know, mental health nurses would love to be working in general practice, but there are funding barriers to that. And that was actually the job that I was doing for that 12 years, amongst other things. I had such a wonderful opportunity to work alongside doctors, mental health counsellors, and also broader community health teams, where we worked collectively to support people, particularly those that have complex social issues. You know, we can't just think of anxiety as an illness we treat. We have to sort of understand the why. You know, why is this person experiencing anxiety? Oh, they've got housing stress, they're under financial stress, there's family system issues. Sort of just treating the anxiety in a silo is not going to help. We need services. You know, for some people, they see their GP, they get a referral to a mental health counsellor, and they have great success. But there are lots of other people with chronic illness, other issues, that they need a bit more of a team of people. And our little service out in Ringwood in Melbourne was a really great example of what you can achieve when you have parts of the service working together collaboratively.
No, you're absolutely right. Addressing all of the factors that underlie somebody's experience with their mental health is so important. And there is so much strain on the system. And like you were saying about GPs, the number one reason people are going to their GP is for their mental health. And those appointments are short. And those, you know, I always encourage people, if they are going for an appointment at their GP, to talk about their mental health, if it's at all possible, to book a double appointment. But the GP, without those other services around them to help support their patients, there's only so much that they can do.
Yeah. And I think too, it's about educating the community about what other services. So, you know, there are also services called primary health networks. So they're federally funded services that are often providing those kinds of social health and psychosocial health services for people that have a lot going on. So, you know, they're wonderful resources. I think there's 31 around Australia that cover sort of large geographical areas, and then they fund different community health programs in the region to deliver on mental health counselling and care coordination, which is something I think we need a lot more of. Drug and alcohol services, you know, lots of other services. Because when I was working in my, you know, will always probably be the favourite job of my life, I think. And when a young person and a parent would come in, I would be like, tell me what the main presenting issue is. Because for some people, they were coming in for mental health, drug and alcohol, family issues. So by identifying from the person's perspective what the main presenting issue was, it then helped me, the mental health concierge, which is something I'd been thinking about. That's kind of really what I did for 12 years, was the mental health concierge. They came in, and my job was, along with my wonderful colleague Heather, was to help people sort of work out, are we the best service for you, or is it someone else? And so if, say, drug and alcohol was the main presenting issue, then we would refer across the car park to the drug and alcohol program. If it was sort of housing stress, then we would refer to Wesley Housing Services, which was up the road. If those things were part of the issue, but the mental health was the main issue, then they would see us. And so, you know, but the wonderful part of the program is that we could see people over the long term, and the GP that people would see. I worked with a couple of lovely GPs, and you know, and Headspace does do some of this similar work as well. But this program was actually in community health, which is slightly different. And we were able to support people over time so that as it happens, people would face hurdles or barriers to accessing care they wanted. We were there to support them to go, okay, it's not that, the maze again. Okay, that's not the right one. Okay, let's go that way. But if people don't have health workers to support them on that journey of this very complex health system, they often then go, I can't do it, and just give up. And then their mental health gets worse, and then they often need sort of hospital-based services. So a lot of what I'm passionate about is trying to help people early on in their mental health journey, rather than sort of waiting until hospitalisation is necessary.
Yes. Yes, and there is a very large gap for a lot of people between noticing first symptoms and then acknowledging a need for help and reaching out. And then there's this chasm between acknowledging that need and then necessarily getting the exact support that is right for that person, and which is obviously what we've been discussing. And it's for listeners who are in that gap at the moment, feeling like they've acknowledged that there's a need for themselves or for somebody that they care about, and they've been to their GP and the GP has said, look, I recommend that some counselling or some psychological support would be really helpful, but then there are waiting lists that are long and difficulty accessing those services. What would be a next step that you would recommend for people to take?
So that is such a wonderful segue, because that's what a lot of people don't realise. You can actually keep seeing your GP. So what we often did, and again, we had GPs that were working in a social model of health and perhaps had an altruistic approach. And so what would often happen is we would refer someone for counselling, but if there was a wait time, as you know, peaks and troughs there was, they would then keep seeing the GP for some interim support. So they might see them fortnightly while they're waiting, because particularly when you've got a good rapport and established relationship with a GP, sometimes a 10 or 15-minute session with your GP can really just help keep you calm, and it can just help that person feel supported. And then obviously when they start seeing the mental health counsellor, then perhaps their need for a GP could be pushed back to 4 to 6 weekly. You know, again, we're working in collaboration here, but that's what I often don't get with, you know, sometimes in our health system is people are given referrals, but then who looks after them in that interim period? You know, the other thing is perhaps, so in terms of sort of some practical strategies for your listeners that are like, you know, I've got these needs and I don't know where to go, is, building a rapport with a GP is fundamental, I think, to good healthcare, because they're one of the only health providers that can see people over the long term. You know, I meet people that have been seeing their doctors for 20 years, 40 years, and then they're retiring and they're like, oh my gosh, what am I going to do? And so then it's again helping them find someone else who fits their values. Most GPs clinics now have, you know, their doctors' pictures and their specialty areas listed on their website. So when I'm talking to someone, I'll be Googling the clinic and, this doctor does mental health, or this doctor does women's health, and then helping people actually find the service that they need. You know, and in many ways, I used to say to young people, don't be a stranger. You know, don't sort of disappear for 8 months, and, you know, stay connected with us, because it's actually really helpful when your health professionals see you in all moods, you know. So even when you're actually feeling pretty good and you're like, I don't think I really need to go, still go, because that's helpful health information. Why are you better? What's actually working for you at the moment? Because then when next time, if you were to come in feeling distressed, we actually go, well, remember last time I saw you actually feeling really good, and this and this and this was happening. That's such helpful information.
Yes, it is. That opportunity to be connected and maintain that level of support, it really helps to give the person who's in distress that real sense of hope, which is so important, isn't it? I think it's really difficult when like you say, you are referred on, and there is a huge gap. And people talk to me about this all the time, reaching out. What can you recommend? And it's very, very hard for people who feel kind of just in that limbo and wanting a help, knowing it's necessary, but really feeling just like I just have to sit and wait. And so that advice to just keep seeing the GP and connecting is important. And what you spoke to before, I think, so important, the point you made about having that connection in the same way that we know that a lot of the therapeutic value of seeing a mental health professional comes from that relationship. And I've spoken before about it took for me to see my third psychologist to find the right fit, and that it is so important. And so don't be afraid to, if the GP that you see, you don't feel like they're the right person for you, to make an appointment with someone else, whether it's in the same clinic, or ask around your friendship circle. Often friends have good advice about who might be a good person to see in the community. So I think that that's so powerful.
Finding the right counsellor is in essence the difference between mental health recovery and not. So I think sometimes there is a understandable frustration for people when they go and see someone and they're like, this isn't working for me. But I think sometimes we do have to approach it like we're looking for the right car. And I use that analogy because cars are expensive. And sometimes, if for those of us particularly who are accessing private services that do cost money and we're investing in that, it can be frustrating to sort of, see someone and it not be the right fit. And I think sometimes it is helpful to sort of approach it like it might take me time. Medication's the same. Sometimes there's lots of different medications. So for mental health conditions, so it's not like, well, this one didn't work, so none of them will work. Sometimes it is about taking time. We've got to find the right recovery plan for you. So when it comes to finding the right counsellor, thinking about what are you actually looking for? I do know of many counsellors that actually do offer sort of a free consult like a 15-minute consult over the phone. And that can be most valuable when it's like, what are your needs? What are you looking for in a counsellor? And sort of getting a sense of if that's a good fit for them. It can, even if people are actually accessing free services, say through community health or the primary health networks, then it's also, you do have the opportunity to say, look, this isn't really working for me. I'm just not feeling a good emotional fit with this person. Is it possible to change? Because as you said, Jodi, the rapport between counsellor and client is foundational to the work. And so, if we do, and same with the GP, I think that when we have good rapport with health providers, teachers, really any bosses, life is so much easier. And so I would say, though, I have what's called the 3-session rule. And so unless there's something in the first session that's clearly evident that a mental health counsellor is not right for you, then give it 3 sessions. And why 3 sessions? Well, I think it takes about 3 sessions for you to feel comfortable and for you and the counsellor to kind of ease into sort of a rhythm of counselling. And, we're people, we're, a bit socially awkward on the first meeting, a bit like the 3-date rule. Like, unless there's sort of something glaringly obvious that this isn't going to be a good fit for me, or I didn't realise they were male, or whatever it is, then just give it 3 sessions. Because what I've found over time, seeing literally thousands of young people, is that after the 3rd session, the vast majority do settle in. It was just getting over that awkward hurdle of they're going to ask me stuff about myself. And, but sometimes after that 3-session rule, people are like, yeah, this isn't a good fit for me. And then you've actually have the opportunity to say, look, particularly in community health, we've tried 3 sessions, it's still not working. Is it all right if I try with someone else? So I think that's really helpful for people to approach it the way you have, is to sort of acknowledge that it took a bit of time to find someone that was a good fit for you.
Yes, for my experience, the very first person that I spoke to was when I was diagnosed with depression. It was the psychologist that worked in the GP clinic. It was a multimodal clinic. And she wanted to do role plays I've spoken about this before. She wanted to put me in a role play with my younger self, which was really confronting, and we just weren't at that point in the relationship.
Exactly.
It was I hope that's not misconstrued. I can't believe I just said
No,
that.
I think it's true, because there's an intimacy that we have in mental health counselling, and it's so true, Jodi, because we know that it is a dance with our clients. Like, where we feel comfortable because we do this all day, every day, but there is an emotional intimacy in counselling that people feel, and they kind of want to run away from, and that is maybe actually something they're doing in their relationships. So I think sometimes the onus is actually on the counsellor to acknowledge that, and to sort of say, I sense that, you're not wanting to do this. I mean, that's why person-centered care is important, because, counsellors should be good at reading body language, and we should be able to see when someone's feeling uncomfortable and then sort of speaking to that. But yeah, sort of acknowledging that there is an intimacy about counselling that can be quite confronting for people, but that's part of the work. And that's why it's so important for you to find a counsellor where you feel safe.
Yes. Yes, and it's so interesting that you say that. Honestly, that's so funny what I just said. People will hopefully get a laugh out of that. But it is. It speaks to the relationship, and maybe that might have been something that would have been useful down the line. But the second person that I saw was just a recommendation from somebody at school who said, "Oh, just go and see this person." And this person she was analysed dreams, and I just found that to be like a bit wacky, to be honest. Like, that for me, with my values, my scientific training and my background, I just sort of felt like, whoa, hang on a second, this feels like a waste of my time. And interestingly, when another colleague at school who was an educator and also a psychologist, she had two kind of hats that she wore, she recommended me to a colleague of hers, and she said, just so you're aware, because counselling therapy, it is challenging. Some people do hop between people when it gets a little bit too, uncomfortable. So she said, just be aware, because this will be the third person that you're seeing. Just be open to a question about perhaps why it is that you've arrived at a third person to speak to within a relatively short period of time. And so I appreciated that. And I think it is true to be aware. It's important to be aware that it is, we go of our own volition because we want help, but we have to do the work when we're there. If we develop a great relationship and that we move at an appropriate pace, that there are times that it is uncomfortable, and that's okay, because that's a lot of growth comes from that. So that journey of mine was really tough when I was obviously enduring it, but I ended up with a person who was just brilliant.
I think that's where counselling goals, so anyone who's had counselling will be like, oh, the counselling goals, but I tend to relate it to sort of personal training goals. Counselling can sometimes feel like you're on the treadmill or on the stepper. And, but I think we understand, and many people I've spoken to, I use that analogy because people are like, yeah, I get that. Like, they might have done that with a personal trainer and they have goals. Like, where do you want to get to? And so in counselling, having sort of, whether you call it goals or sort of or mental health recovery plan, I really like that term, is sort of, where are we going to? Because then it's, are you the right counsellor to support me on that journey? And I think, your colleague's right, when we do chop and change, but if there's clear reasons why it just wasn't a good fit, it's like people are dating and they have to see lots and lots of people before they meet someone who's a good fit. I think we're still human, but I think it can be really helpful, for people to be able to, and your listeners to be able to say, yeah, what do I want to get out of counselling? Because that will actually then help them perhaps look for the person, like based on their bios and stuff, to find someone who does have a good fit. So for some people, they do want to see someone who can do dream analysis. But for others, they really want someone that's more scientific. So, a clinical psychologist may be better for them. And that's where the spectrum of mental health care, whereas I guess, I would love to see more care coordinators, I guess, because sometimes people need support to navigate that maze that is our health system.
Yes, they do. And I know that there is a positive psychology clinic down here in Mornington, and they have a care coordinator. So as a new patient,
Great.
as a parent ringing up on behalf of their child, or as a patient, and I know that positive psychology is in a number of locations, and other centres may do this as well. But the first conversation is with the care coordinator to understand just a little bit about what the needs are, and then to hopefully match you with the person who's the best fit for your needs or for your
That is
child's needs. So it
awesome.
helps to, helps to sort of avoid some of those wobbly kind of
Mm,
starts on occasion. And there still will be wobbly starts, depending on the client's needs. But I think it's a really important role, and it also is just that first beautiful warm welcome into a community at a clinic too. That person's role is to really help the person feel more comfortable and really heard and listened to.
that's it.
So yeah, so no, it's great. I have one last question
Mhm.
for you, and one of the things that I am experiencing a lot in my work at the end of a presentation, when I talk about really when I help people in my work to understand what's kind of normal versus what type of signs and symptoms might point towards somebody needing some extra help. And I really help to sort of guide people towards I guide people directly to their GP to say, look, if you're even asking a question, should I seek more help with this, then that's a great pointer to say, yes, go and ask that question of your GP. But a lot of parents will talk to me, and it's very, very distressing for them when they'll come to me afterwards and say, we've recognised this issue and this challenge for our young person. They're suffering. We're suffering as a family, but they will not seek help. They will not go to the GP, or if they've been to the GP, they will not talk to somebody. What would you say to a parent who is asking you that question as to what do we do next?
Such a good question. And I've had that conversation with a lot of parents as well over the years. And I think for anyone really of any age, but particularly young people, readiness for counselling is varied. And particularly young people under 16, it's challenging. Counselling requires a lot of insight, a lot of emotional reflection. And for some young people, they're just not either developmentally there yet, or they're just not ready yet. And so, readiness for counselling is really essential part of the process, and kind of against the power over power two analogy is forcing people to have counselling when they're not ready devalues counselling, because then they're less likely to access it later in life when they actually really need it. So from a person-centred approach, nobody should be going to counselling against their will. Obviously, though, in youth and families, there are a lot of challenges. And so I worked with some wonderful family therapists while I was at that program. And they really taught me that if a young person's not ready yet, there is value of working with the parent. So, because a lot of the time, adapting and changing our parenting approaches can sometimes be a catalyst for change in a family. The same goes with drug and alcohol problems. So the drug and alcohol problem at our service, if the person who was experiencing the substance use problems wasn't ready yet, then they had a family program that they could access to get support for themselves. But I think, again, we need to think in more of a holistic way when it comes to health problems in families, because sometimes when someone else in the family, actively seeks support, it can be a catalyst of change for the family. But I'm also reminded of there's a wonderful service called Bloke Psychology in Melbourne, and if you want to, their Instagram and Facebook page is funny. Like they share a lot of great content. But one of the posts recently was about many people in counselling are going because someone else in their life isn't prepared to go. And I think that that's just a common experience. But rather than, giving into the frustration, is particularly when it's a parent-child relationship, but even for couples, seeing the value of you going and perhaps learning about that illness. So like back to our conversation about mental health first aid, sometimes those counselling sessions can be about supporting parents in their distress, but also being educated about how anxiety, depression, eating disorders or whatever presents in young people, and then being educated, which will help inform and support them to approach it differently. Because, and I often say to families, when it's our family, everything we know goes out the window. When there's emotion involved, it's so much harder, and we need our colleagues to help us when it's our family. But when there's emotion involved, that it's a really hard program. But again, it's sort of little steps. At the same time, and this is why reaching out for support is helpful, because there are, and I've actually seen this happen recently, where I was supporting the parent, and then they eventually did reach out to the hospital service, and the young person, mum sort of, changing her approach, was able to get to the young person to that first appointment. Who knows what the outcome's going to be. But I think supporting parents in their difficulties and their distress can be the start of the young person's mental health recovery journey.
Thank you for sharing that. That answer is going to be so helpful for so many families. And I think about a lot of the reading that I've done around the area of anxiety, and Eli Leibovitz has a book all around supporting parents to support their children with anxiety and OCD. And it's purely a program aimed at parents. The children are not involved in the learning directly at all, because there's so much that we can do as parents, knowing how to respond, how to listen, what our other options are when it comes to supporting our children in our own homes. Especially, I think about so many young people are refusing to go to school and struggling to get back into the routines that they were in because of particularly, being Melbourne based and the lockdowns and the devastation that caused in the lives of so many young people whose mental health really suffered, but also that avoidance is really playing a really big role in their lives as well.
Definitely.
That I think parents can just feel so terribly distressed and really stuck and just at a loss as to, the outcome is I would love my child to go to school every single day and I'd love them to go to school happily. And so, between now when the child just will not set foot in the car or hop out of the car versus it just feels like such a long journey. And so the advice for parents to be able to seek that help themselves, and a previous guest, Martine Oglethorpe, works for Headspace. She also had some really complimentary and lovely suggestions as well with regards to just sharing some resources and also just really maintaining that connection as a parent with the young person so that they feel supported and loved, and that when they are ready, that you've got that relationship intact to be able to really support them to move forward.
And I think it's also a mindset shift for us as a broader community that mental health problems are on a spectrum. Some are acute and then some are chronic. And so some are acute and you get treatment and people have short recovery times, but probably the vast majority, it sits more in that chronic illness space. And so again, recently, had said to a parent, it's about approaching it like you would cancer treatment or diabetes treatment. Diabetes treatment, particularly like if they have type 1 diabetes, it's something you're going to have to manage over their lifetime. And so, whereas I still think we're in this quick fix mentality with mental health problems, and we really need to sort of understand that there is hope for recovery. There's absolutely hope for recovery. Like other people with, say, chronic pain issues, it's again finding a recovery plan that helps them live their best life. they may still have the illness. They might still, have to manage that day to day. That's anyone with anxiety, that's often their experience. But you learn to sort of turn it down. You learn what your triggers are. You learn how to not push your body to the nth degree, because then you'll topple over the edge the week later. We have to listen to our bodies. But I think that acceptance of illness and that acceptance that we, that for whatever reason, there's not necessarily a quick fix, because if there was, someone would be selling it, And a lot of people are trying to sell things that are supposedly the quick fix. But my experience is that, and I probably have worked with people who have more complex and long-term issues, but I have actually seen people get on a mental health recovery journey. I have seen people find hope beyond that period of distress, and they still manage anxiety, they still manage periods of depression, but they actually have a set of tools now in how to manage that. And again, coming back to mental health first aid, seeing mental health as an extension of our physical health. Like, it's our brain after all, it's an organ. It's not outside of us. It's intrinsic to who we are, but also our life experiences impact on our mental health and our emotions. And the last 2 years have been particularly challenging. And I think we all need to give each other and ourselves a break to sort of see we're still in a period of adjustment coming out of that really difficult period in our history.
Well said, well said. It is a period of adjustment. And there was some good news today. Recent studies come out, I think it was ANU, saying that, understandably, there has been a lot of improvement in life satisfaction and in the amount of psychological distress among young people because of that return to routine and more predictability and all of the lovely protective opportunities of sport, seeing friends and moving and having, more freedom and more choice. It's so there's a lot of good news, and there is a lot of hope. And I think too, what you've said about the perspective of approaching it from that long-term point of view is that even those of us, well, I say us because I thrive with anxiety. I'm medicated for my anxiety. I have a serious anxiety disorder that I manage really, really well because I'm well equipped and I've had a lot of good support around me, but it took a long time. And it's not like I don't struggle and suffer still. I said to you when we first met, didn't I? I'm feeling really anxious today. So you'll see that it's with my breathing that you'll notice it. But I really just want for people listening to know that this episodes like this, talking to people like you, Jacqui, who are just so knowledgeable and have so much experience, so much wisdom, that it is a journey. It is going to take time, and it can be really hard, but using what you're learning from the podcast and from the professionals in your life to look after yourself, if you are supporting a young person, or to take the steps to move in the direction of that mental health journey with support. There's so much light along the way, and there's a lot of hope for a really bright future for anyone, but it's just getting on the path and finding your way through the maze, and hopefully we've helped people to do that.
Definitely.
To do that today. Jacqui, how can people connect with you? I'll put all of the details in the notes for anybody to access, but if somebody wanted to join you for some mental health first aid training, a couple of questions. Is it always in person? How long does it take? And do you have certain intake times, and how does it all work?
Yeah, so I really like working with teams or community groups because it helps me tailor it to the person's needs. But really, people can get in contact. Mental Health First Aid Australia also has community-based programs listed on their website. So there's I want to say 2,000 instructors around Australia in different parts. So because of the pandemic, we now can do them via telehealth. I think that's a really great resource, particularly for people that are time poor, because it breaks up the theory from the practical learning. So you do some theory and then have 2.5 hour sessions with an instructor. but also, but you can do face-to-face, which is 2 full days of training. And again, so if you're an individual wanting to connect with a community group, then the Mental Health First Aid Australia, there's lots of instructors that have community groups listed. Whereas, I really like working with community groups and workplaces, again, because I can tailor it to the particular need. Church groups, whoever, who really wanting to support the communities that they're working with. That's sort of the kind of work that I really enjoy doing. You can just go to my website, nursingthemind.org, also on Facebook and Instagram, Twitter as well, which is always an interesting place to be. But it's a good place actually to keep up with a lot of health information. But yeah, it's been such a pleasure. I've really enjoyed talking with you, and I've obviously listened to some of the other episodes, and I'll be definitely passing it on to my clients as a resource for them.
Oh, thank you for saying that. It really means a lot because, I really feel so strongly about just opening the door to make sure that information like this is accessible so that people are equipped to make the decisions that are really going to benefit them in their life. And I feel so privileged to have had the opportunity to spend this time with you because I've learned so much, and it really just empowers me to help more people that I connect with in my walk in life to be able to share this information and make sure that people have what they need, feel equipped to be able to make decisions in their own journey. And so I'm so grateful, Jacqui, and I thank you again very, very much for your time. And I will look forward to releasing this episode and really supporting people with this really, really important information. So thank you again.
Thank you.
Thank you very much for joining us today. If you know of somebody that would benefit from this episode in particular, you know of somebody who would really appreciate more insights into really bridging that gap between needing help and getting the help that is most suited for the person that they care about or for themselves, please share. Thank you again for joining us, and I will be back with you again next Wednesday. Thanks. See you next time. Bye. Thank you so much for joining me for this week's episode. If you enjoyed it, please subscribe and leave a review. To keep the conversation going, I'd love you to join me over on Instagram. You'll find me at Dr Jodi Richardson. Also, if you'd like a copy of my free 5-day mini email course, Calm Your Anxious Brain, then jump over to my website, drjodirichardson.com, and you can sign up down the bottom. I've really enjoyed having your company. Thanks so much. See you next time.